The World Health Organization warns that the health system in Sudan is nearing collapse as violence continues to target medical facilities. In February alone, 4 attacks were reported on health centers and hospitals. 3 strikes in Kordofan left dozens dead, while another hit Al Mazmoum Hospital in Sanar State. The incidents have been attributed to the rapid support forces. A recent report by the United Nations says more than a third of health facilities are no longer functioning, with many others only partially operational. The disruption is leaving millions without care, especially pregnant women and vulnerable communities. Our correspondent Naba Moudine joins us live from Port Sudan. Naba, welcome to the program. Thank you for joining us here on Africa Live. Naba, the WHO's warning points to a dire situation in the healthcare system. How bad are things on the ground? What do we know?
Thanks, Richard. Actually, the situation regarding the healthcare system in Sudan is deteriorating and it's beyond dire, Richard. So all of the warning points issued by WHO, we are seeing and tangible. We can see it impacting millions of people in Sudan. The WHO warned that 1/3 of Sudanese healthcare facilities are out of service, while most of others are partially functioning, meaning that millions of people can't access basic life-saving care, including maternal care, surgeries and treatments of chronic diseases, and also diseases that right now is spreading because of the war, like cholera, malaria, and dengue fever. So repeated attacks on healthcare and on hospitals is spreading fears and displacements among people. We are seeing a collapsing healthcare system, although some areas that is now controlled by the Sudanese military, like Khartoum and Al Jazeera, we are seeing life is getting back to normalcy, especially in healthcare system, where hospitals right now are reopening. But generally, we can say the healthcare system in Sudan is collapsing, with hospitals being used as military sites and being targeted by the fighting. Most of the people in Sudan can access life-saving treatment and care, which of course exacerbating the situation on the ground, Richard.
Naba, let's unpack that information a little more. Talk to us about the states in Sudan which are the worst hit in terms of attacks on health facilities and the killing of healthcare workers and patients.
Actually, Richard, among the top of states that is repeatedly attacked by the RSF and caught in the crossfire of fighting is South Kordofan. According to WHO report, more than 30 people got killed in February alone in 2026 in South Kordofan, being targeted in healthcare facilities, including hospitals and clinics. Many people got killed in Sinar Hospital, being attacked in mid-February in 2026 alone. And number 3 is Al Fashir, the third state that is repeatedly targeted by the fighting and healthcare are targeted is Al Fashir, that was under siege for 18 months. The Saudi Maternal Hospital and also the Saudi Hospital were attacked, and they saw and experienced siege conditions. So we are speaking about 69 people, Richard, got killed in since the beginning of the year alone in 2026, and we are talking about hundreds of attacks since April 2023, when the war erupted between the Sudanese armed forces and the rapid support forces. So the statistics are big. More than 50 people got injured within 2 months and 69 are killed. But there are fears that once healthcare facilities are targeted by the fighting and they are seen as a military gain and a military site, they used to be occupied and used as a weapon, there are fears that the number are likely to increase, Richard.